Person-centered care ties evidence-based practice to compassion and personal beliefs, and it is for this reason that it is the most fundamental aspect to healthcare. Person-centered practice is considered to be the approach in which care is delivered, enabling patients to be active in decision-making processes and form relationships with healthcare professionals based on trust. Through placing the person in need of care at the center of all medical decisions and practices, person-centered care evidently improves the satisfaction of patients. This type of practice aims to have individuals seen as unique human beings by their healthcare professionals rather than their next subject to work on. Person-centered care must take mental health as well as physical health into consideration, as the two are codependent. Respect must be given to individuals on all levels, including cultural, religious, financial, spiritual, and emotional, for healthcare to be truly person-centered. Person-centered care extends to include family, friends, and their community in whatever way the person at focus defines them. Across the multidisciplinary healthcare team, the main goal for treatment must be shared and tailored around the person's needs, values, and There are 5 key contributors to the person-centered practice framework developed by McCormick and McCants. The outer layer of the framework is the macro context, which includes how broader organizational factors such as healthcare policy, strategic frameworks, workforce developments, and strategic leadership impacts the workplace. The prerequisites is the next domain, which includes the skills and qualities that healthcare professionals must possess to deliver person-centered care. Some of these prerequisites include professional competence, interpersonal skills, and self-awareness. The next key attribute is the care environment. For care to be person-centered, the environment must support shared decision-making, be organized, allow for balance of power between the staff and care receiver, and positive and effective staff relationships. The system that is providing care needs to be operational with an appropriate mix of skills, facilitation of shared control, and risk-taking potential. Person-centered processes is the 4th domain in the framework, which contributes to delivering care to the person through activities. Individuals' beliefs and values must be incorporated into every process that is delivered to them, and it is vital that they are on board and engaged. When delivering care to a person, it is important that the healthcare professional shows sympathy, and they must provide for physical needs. The 5th domain in the framework is person-centered care outcomes, which encompasses the results of the person in care. The person must be involved and satisfied with their care, and the environment must be therapeutic. The prerequisite chosen for this task is developing interpersonal skills. The prerequisite developed by McCormick and McCants consists of having developed interpersonal skills, commitment to the job, a clear understanding of own beliefs, knowing self, and being professional. Let's look at the relationship between interpersonal communication to build interpersonal skills. Interpersonal skills are those we use every day to interact and communicate with others. Within a clinical setting, the skills are developed through effective communication to help professionals establish relationships with their patients, clients, and peers. The registered nurse must use a full range of communication methods, such as verbal, nonverbal, and written language, to interpret the knowledge of patients and understand their needs. Having good interpersonal skills is crucial for providing patient-centered care, particularly when creating an overall positive experience for patients or clients. A way of measuring the key skills needed to engage in therapeutic and professional relationships is the ANSAT tool. The ANSAT tool is a formal source of feedback which is used to measure professional competency and in turn improves person-centered care. It includes 7 domains and 23 point of performance criteria expected of nursing students. The ANSAT domain discussed in this task outlines the key components that need to be met in order to successfully engage in therapeutic and professional relationships. The prerequisite relates to the ANSAT domain as it underpins the key skills needed to engage in therapeutic and professional relationships. Engaging in therapeutic and professional relationships is important for establishing the needs of another person, building trust, clarifying person-centeredness, and having effective nursing procedures. However, to do this successfully, we need to be skilled communicators at an interpersonal level to meet the obligations of the ANSAT tool. Emma described the prerequisite as outlined in McCormick and McCants' framework and described the ANSAT domain. But how does this relate to person-centered care? As we have learnt, developing interpersonal skills is important for nurses to create a supportive environment for patients and their families. By increasing interpersonal skill, this is encouraging person-centered care outcomes for the patient. How, you may ask? Referring to the person-centered care framework on the slide, you will notice the second level of the framework are the prerequisites of delivering person-centered care. The prerequisites are a guide for nurses to create a person-centered care environment while also improving existing attributes. The prerequisite develop interpersonal skill assesses a nurse's ability to communicate at a variety of levels with others, using effective verbal and nonverbal interactions that show personal concern for their situation. By developing interpersonal skills, this is creating a safe environment for the patient to feel open and helped, and this is key to patient-centered care. To deliver person-centered care, nurses must also follow the ANSAT domain to engage in therapeutic and professional relationships with patients, families, and other staff. In the Nursing and Midwifery Board, it states a nurse must establish and sustain relationships, communicate effectively, provide support, actively foster a culture of safety, and provide professional relationships. These are all important attributes to providing person-centered care. Communication is the ability to express opinions, emotions, and perspectives. Humans communicate to share ideas and make sense of the world, and this can occur through spoken, written, and nonverbal methods. Communication plays a role in many professions, and nursing is no exception. Therapeutic communication techniques are fundamental strategies used in nursing and are based on the principle of patient-centered care. These techniques encourage open communication and are also a way for nurses to display understanding and respect. An essential therapeutic technique is active listening. According to Bethell, active listening means listening attentively with one's whole being, mind, body, and spirit. Through active listening, nurses are able to have a better understanding of the whole message that is being communicated. To listen attentively, a combination of nonverbal and verbal cues are utilized. These cues indicate not only a physical presence, but that the nurse is in the moment, focused and available. Verbal cues include not only the words being spoken, but also vocal elements such as volume, speed, tone, and pitch. Eye contact, facial expression, posture, gestures, and the time and place of an interaction are all nonverbal communication factors which will affect the value of the communication. McCormick and McCants tell us a lack of interpersonal communication skills can have an overwhelming effect on patient care and may add to a patient's feeling of helplessness. However, effective relationships can be built based on trust if the provider can demonstrate understanding, a commitment to listening, and an attempt to meet some of the needs of the patient. The innermost part of the person-centered care framework outlines the expected results of effective person-centered care. These results include good care experience, involvement in care, feeling of well-being, and existence of a healthful culture. A good care experience encourages individualized patient feedback, including objective facts and their subjective perspective. Active listening provides nursing students with the appropriate skills needed to dissect and understand patient perspectives. These skills include recognizing subtle patient cues, concentrating on and exploring what the patient is communicating. Therefore, active listening maximizes the clinician's ability to accurately comprehend the patient's feedback. According to McCormick and McCants, involvement in care emphasizes the expectation that patients work in partnership with healthcare providers, enabling them to be active participants in their care. Active listening allows nursing students to achieve this person-centered outcome as it encourages conversation and establishes rapport by ensuring patients feel heard and valued. By doing so, active listening creates an inclusive environment in which the patient's voice is empowered and facilitates collaboration between healthcare professionals and the patient, therefore maximizing patient involvement. Furthermore, active listening amplifying patient value allows nursing students to deliver a feeling of well-being. This is achieved through positive care experiences in which the patient feels respected and valued. The existence of a healthful culture requires shared decision-making and a broader definition of health, encompassing social and cultural contexts. Utilizing active listening enables nursing students to explore the social environment and cultural values relevant to their patient, as it demonstrates interest in the patient's perspective, thus establishing trust and facilitating vulnerability. Active listening's crucial role in delivering person-centered care outcomes allows nursing students to achieve the ANSAT domain assessing engagement in therapeutic and professional relationships. This is because it facilitates careful listening and sensitivity to patient and carer views. Furthermore, active listening enables students to communicate with the patient in a manner and environment that demonstrates consideration of patient or client sensitivities. Therefore, active listening is an effective strategy in achieving communication-related factors of the ANSAT domain.